Kerasol 6% cream introduction. Salicylic acid is a naturally occurring compound with a wide range of applications. It is often used as an antiseptic, anti-inflammatory, and anticancer agent. It is also found in many topical skincare products, such as creams, lotions, and ointments. It is a white, crystalline organic acid derived from the bark of the willow tree. Salicylic acid is most commonly used to treat skin conditions, including acne, psoriasis, seborrheic dermatitis, warts, corns, and calluses. It may also be used to treat conditions related to hair and nails, as it can help to reduce fungal growth. Salicylic acid is known to have anti-inflammatory and pain-relieving properties and can be used to alleviate pain associated with arthritis and other inflammatory conditions. Mechanism of action. Salicylic acid works primarily by disrupting the cell membranes within skin. It can also stimulate the body's natural production of keratinocytes, which can help to reduce inflammation and break down existing keratin in the skin. Because of its non-comedogenic properties, salicylic acid also serves as an effective treatment for acne. How long does it take to work? Salicylic acid is a fast-acting skincare ingredient, and the effects of topical applications are usually visible within 24 to 48 hours. However, for best results, it is important to use a consistent treatment protocol. Absorption. Topical salicylic acid can be absorbed through the skin, although the rate of absorption is slower than with many other active ingredients. Absorption is increased when the salicylic acid is combined with other ingredients. Oral formulations also exist, and these are absorbed through the stomach. Route of elimination. Salicylic acid is eliminated primarily through the kidneys. It can also be eliminated via sweat and urine. Dosage. Dosages for salicylic acid depend on the specific product or formulation being used. For topical formulations, the usual concentration is 0.5 to 2%, although stronger concentrations can be prescribed by a healthcare provider. Oral formulations typically contain 2 to 6 grams of salicylic acid in divided doses. Administration. Topical salicylic acid is most commonly applied to the affected area in a thin layer twice per day. Lower concentrations can be applied more frequently. Oral salicylic acid is typically taken with a glass of water. Side effects. The most common side effects of salicylic acid are mild skin irritation and itching. Lower concentrations may be more tolerable for sensitive skin. Some people may also experience nausea or vomiting when taking salicylic acid orally. Toxicity. Salicylic acid is generally considered safe when used appropriately. High concentrations or prolonged use can lead to salicylate poisoning, which can be fatal. Symptoms of salicylate poisoning include confusion, dizziness, ringing in the ears, abdominal pain, and difficulty breathing. Precaution and drug interaction. It is important to consult a healthcare provider before using salicylic acid in order to ensure that it is safe and appropriate for the individual. Salicylic acid may interact with certain medications and should be used with caution in people taking anticoagulants, nonsteroidal anti-inflammatory drugs, and some antibiotics. Food interactions. Salicylic acid may interact with foods high in vitamin K, such as green leafy vegetables or certain animal products. Eating these foods while taking salicylic acid may reduce the effectiveness of the medication. Pregnancy and lactation use. It is not recommended to use salicylic acid during pregnancy, as its safety has not been established. It is also not recommended to use salicylic acid while breastfeeding, as it can pass through the breast milk and reach the baby. There are other, safer alternatives for skincare during pregnancy and breastfeeding. Acute overdose. An acute overdose of salicylic acid can lead to salicylate poisoning and potentially fatal complications. If an overdose is suspected, seek immediate medical attention. Treatment may involve activated charcoal or a solution such as sodium bicarbonate. Contraindication. Salicylic acid should not be used by people with allergies to salicylates or aspirin. It is also not suitable for people with certain medical conditions, such as asthma, kidney or liver disease, or high blood pressure. It is important to check with a healthcare provider prior to use. Use direction. Instructions for using salicylic acid should be followed closely. For topical applications, The product should be gently massaged into the skin using light circular motions. Avoid contact with the eyes and mouth. For oral formulations, the medication should be taken with a full glass of water. Storage condition. Salicylic acid products should be stored according to the instructions provided by the manufacturer. Generally, these products should be stored at a cool, dry place away from direct sunlight. Volume of distribution. Salicylic acid has a volume of distribution of 0.2 L per kilogram, indicating that it is widely distributed throughout the body. Half-life. The half-life of salicylic acid is estimated to be between 60 and 90 minutes. Clearance. The clearance of salicylic acid is estimated to be between 10 and 18 milliliters per minute per kilogram.